Yesterday we talked about the three parts of the interaction. Really, I think there are just two parts. There's the individual agent, in our case the person, and the bacteria. The environment, or the context, is really the playground where these two elements in our environment are playing together. Bacteria have a decided edge because they mutate so fast, they adapt so rapidly, and we can't keep up with their adaptations. So we need to figure out a different way to look at this interaction between us and the bacterial world, and that's part of what we're going to be talking about. In order to see this environment, this is the playground. If you could look in the back of a healthy nose with a microscope, this is what you would see. Down here underneath is all of the basement membrane, the blood vessels, the airway epithelium with the cilia. Cilia is like the broom, and you sweep. What you sweep is the mucus that is up here trapping all of the bacteria. If mucus is optimally wet, it is really, really, really sticky. And bacteria get stuck in it. And they get swept out. From the front of the nose to the back of the nose, it usually takes about 15 minutes for this mucus to get swept down where we swallow it. And we swallow it without really noticing anything going on because it's a normal process. And in between is airway surface fluid. The airway surface fluid is there because if you've ever tried to sweep with a broom 6 inches long, it doesn't work very well. And so you need space for these cilia to work. The airway surface fluid also comes from the basement membrane blood vessels, and it has defensins in it that are protein substances that help fight bacteria. If you compromise your airway, if you smoke, it paralyzes the cilia. They're disorganized in their function. They don't really sweep well. If you are dehydrated, then the mucus doesn't function well. Imagine trying to clean this mucus out as opposed to the one in the previous slide. And dehydration plays a fairly critical role in this process. This is a very interesting slide that I have looked at and tried to figure out what exactly he is saying, because you can see the effect of humidity across the bottom, and the effect of humidity on common nasal irritants. So when it's very dry, you have a lot of bacteria, you have a lot of viruses. When it's very wet, you have the same. You have the same here because these infecting agents can live on water droplets, and so they're easier to transmit from person to person. If you cough or sneeze, you're expelling water droplets with these things on them. But when you look down here, you'll see respiratory infections that are really made up of bacteria and viruses, but there's nothing over here. Why is that? Well, I think the reason for it is because when it's optimally wet in a humid environment, your nose works better because it can pull the humidity from the air to fill up that airway surface fluid and to make the mucus optimally wet. And so you don't have a problem with respiratory infections when it's really wet, or as much, unless you have allergies to mites and fungi that can create more of a problem, and you have more asthma due to these elements when it's wet.